We now get into a feature that's a little bit different. Now, innovation in technology has impacted various aspects of life and contributed to not just globalization and civilization, but has created many opportunities for all to live a better standard of life. So in the same vein, there's no disputing the positive impact of technology on healthcare, such that today many groundbreaking and life-saving procedures and medications have evolved and continue to evolve. So some of the health IT serves three purposes: to provide better care for patients, make the job of healthcare practitioners easier, and generally achieve health equity for all. So on Tech Tuesday today, we focus on the use of electronic software in our healthcare system and how they can improve healthcare delivery in Africa. Really excited to be joined by Nigerian-born American Olaide Eniafe, and she's an IT analyst who trains healthcare professionals to use electronic software in managing and treating patients. Well, it's quite a mouthful. Good morning and welcome.
Good morning. How is it?
I'm great, thank you. You're looking so colorful. I'm like, okay, are we talking IT and healthcare? I'm excited now. Let's get into it. What does it entail? What is the work of an IT healthcare trainer?
Okay, so basically, here is the thing. And we all know the meaning of EHR, EMR, like electronic medical records. And then we know the benefits of electronic medical records. We know that, okay, you store data, patient data and information, vital signs, allergies, and then medical history, past medical history, past surgical history of patient. So it's basically easy for every organization, every hospital, every clinic to have this information pulled up.
Okay, so it's like in a database, so it's accessible across
so the back in maybe the beginning of the last decade, everybody used to say that, the world is going digital. The world is not going digital anymore. The world is digital already.
Yes,
everything is now cloud-based. So I mean, it practically helps. Like you're moving from paper. It's not the world we want to keep doing the paper chart anymore.
Yes.
So that is when the IT analysts, that is when they come in. So IT analysts come in that vein and, go into the hospital as a trainer. So before it takes a lot. You want me to tell you the whole process of the implementation?
Because I was going to say, before we can even train, these systems need to be available. The technology needs to be available. Because I'm thinking of, I don't want to name names and name countries, but the last time I was in a hospital, they were looking for my file.
Oh God.
For paper. So let's break down, because you've mentioned a few sort of very specialist terms: EHR, EMR. So what's the difference between the electronic medical record, which is the EMR, and the EHR, which is that electronic health record? What is EHR?
So basically both are the same thing.
Okay.
But they just use simultaneously. Electronic medical record, electronic health record.
Okay.
They are practically the same thing.
Okay.
Because both are the same. It's practically the same thing. They do the same thing, just keeping patient data. Keeping it private, confidential. It ensures confidentiality, Privacy Act, and there are laws. We'll get into that as we go.
So, okay, let's actually start with the laws.
Okay. Because,
globally, you can go into your doctor's rooms, you can go into the hospital, especially in an emergency case. When it's a regular checkup, this is less critical. In an emergency case, you need them to pull up those details sharply. Now, where are we with regards to laws in Nigeria? Let's start here at home in Nigeria. With regards to ensuring we implement some of this technology that allows our records to be readily accessible.
I actually checked, and practically I don't know how effective it is in Nigeria.
So the law exists, but it's not being implemented.
It exists, because there are laws like the HIPAA law. HIPAA is Health Insurance Portability and Accountability Act. Okay. Which ensures the patient's privacy of his data. It ensures, like I said earlier, confidentiality. And then those laws have violations with it as well.
Okay.
There are not laws that you can delete. Because let me say, like, you and I work in the same hospital now. And one of the EMR that I train over there is called Epic. We have different EMRs. We have Epic, we have Senel, we have Allscript. These are EMRs that hospitals, these are softwares that hospital uses.
Okay.
You know, so let me use one of them. Let me use Epic, for example.
Are these the ones that are being used in Nigeria, or these
they are not
globally?
used in Nigeria.
Okay.
But they're used in like Europe, the US.
This is sort of
globally,
the world standard.
Yeah, the world standard
software.
of, yes.
Okay, fine.
You know, so now let me say, now you're probably holidaying, someone is on holiday in Dallas, Texas or something, or somewhere around the world, and probably fell sick or something, and it has to be rushed, like, you know, you said, an emergency situation. And he gets there. All they have to do is to find out the patient's probably the last name or something, or date of birth. That will pull up all the patient's information. In the case the patient is not even able to see anything, patient is not able to talk, is not able to, you know. Of course, yeah, they're able to, the doctor is able to see, the allergist is able to see the patient's last.
So how much of the burden of making sure this is available is on the patient? We as citizens, is this something that, okay, fine, it's not really available in Nigeria, but is it something that we can ensure is with our travel insurance, so that when we do travel abroad, our information is available, or we're not there yet? It's not. Is it still a B2B?
I think it's a B2B for Nigeria.
For Nigeria,
I think right now, I think I checked. Nigeria is beginning to adopt some software. Okay. I see that Nigeria have Helium, and then I see that Nigeria have Genesis, and MedStation. But I checked with the Helium, and I find that is pay as you go. So pay as you go, that's for the hospital. Okay. But I don't know how effective that would be. Because, you know, pay as you go, like, doesn't mean when they run out of it, it's not a one-time thing. Like now the hospital can just implement it and they run it. They pay once to the software company, which is what the global thing is. Yeah. You know, and the company run it, the hospital run it. They have all the database, everything.
So it's like buying a computer and now you own it. You don't have to do installments on it.
You know, so I don't know where Nigeria is at the moment.
What are the challenges?
But I feel Nigeria can get there. Nigeria, there's nothing not achievable.
What do you think is stopping, Nigerian? People always want to shift the conversation to the state, but the state is burdened, right? Private hospitals. What's stopping private hospitals in Nigeria and in the rest of Africa from implementing this? Is it lack of information? I've been to one of few to private hospitals, and it's shocking to find out that most of these private hospitals are still on paper. And you go to a private hospital now, and then the next 5 years, they don't even have your information anymore. Yeah. Or they have the pile of paper and, going through
this, I think one of it should be lack of information. Okay. They're probably not much informed like they should be. Or maybe they feel, this is more, it's not really affordable. Yeah. But it is. It is, software, EMR is affordable. They have to look, the first thing you consider is the patient care. Because for everything, patient care should come first. Yeah. For clinic, for hospitals, the patient care has to come first. You have to be able to you go into the hospital, they don't even know what your medical history is. They don't know what your past surgical history is.
Is it possibly that we're not ready? Because, I had a debate over, this December period with some of my relatives, and they were saying it was a debate between sort of the younger generation and the older generation. Yeah. The older generation is saying, excuse me, they'd rather go to, the old school dentist. It was about dentists. The old school dentist, they don't need anything fancy. They don't need all these kids who've just come out of university with their fancy degrees and want to do tech. They want good old school. They know that it's tried and tested and it works. And the younger generation is saying, no, guys, this thing doesn't have to be so painful if you're using lasers and you're using this and you're using that. But do you think Africa as a society is ready to trust their entire health records, virtually in a cloud? I mean, most people have peace of mind.
Well, I think basically the first challenge I say is the human challenge. For even back then in the US, for every implementation, it's usually the first challenge is usually the human challenge, because let's be honest, nobody wants change. Yeah. And we also have other nurses, all the surgeons that have been doing all the paper chatting. Oh, I know all my patients. I put it in writing. I don't want to leave. No.
So it's not an African thing.
You know, so no, give it to me. No, I know where it is. I'll write it out and all that. You know, so that's the first thing. Are we ready yet? And then are we ready to really accept it? You know, but looking at it, I think the government, like I said, so in the US, the HIPAA law that I said earlier was put into law in 1996.
Oh, wow, that's a long time.
It's a long time. You know, so each hospital has to have to go from paper charting to electronic charting. You know, because looking at it, you don't want to have whole paper everywhere, when you can just have a small computer somewhere, and then my information stored in the last 5 years, they could just pull it up. And it's not even about that alone. What about the patient? What about the patient safety? What about coordination of care? You know, so like I mentioned earlier, one of the EMRs that I trained, let me go back to that EMR Epic. So now, like, let me say I'm a nurse and I want to give a patient medication. So now, because now I'm on electronics, first of all, you want to go into the system, you want to check to make sure the doctor put in the orders.
Okay.
If there's no orders, you can't give the patient the medication. Even if it's an IV, you cannot do nothing. So it tracks the whole process. You know, now, as soon as you log in, let me say I'm the nurse, I log in as Olaide Eniafe. The system already has me logged in as Olaide Eniafe. Everything I do, I go into the patient chat, the system has me like, oh, I went into John Doe's chat. I went into Bukola Fademi's chat. If I'm not supposed to go into Bukola's, let me say Bukola Fademi is my co-worker, and I have to go into our chat. So for hospitals, there is another law. It's called, there's something I have to do. It's called braided glass. I have to give a reason why I want to check Bukola Fademi's chat. Because we are co-workers, we work in the same hospital. So what is that? That is protecting Bukola's privacy.
I understand.
That is confidentiality.
It's confidentiality, but let's turn it, you know, sometimes I like to play devil's advocate, especially where tech is related, because we found that, especially lately, tech is being used in many times in ways that it was never intended to be used by the developer or by the creators of it. In so many different, you know, I read an article on something called the Silk Road, which is basically a gentleman who created something like Facebook for the underworld, though, where they started trading body parts and arms and so forth. So you find that people can take this technology and, you know, with minds that aren't sound or intentions that aren't noble, turn it upside down. How do we prevent, you know, our medical records being leaked? People who shouldn't have access, you know, to our, you know, right now we have a whole issue with our data.
Like I mentioned earlier about HIPAA. So whereas under HIPAA, there's HIPAA violation, and there's something also called PHI. PHI is protected health information. So these are laws that protect your information.
So I know that my data or our data as Nigerians isn't being sold to Americans for some type of study that we don't know about. You know what I mean?
So all those things protect you as an individual. It protects your data. It protects your information. You know, it protects everything about you. Because if I violate, if anyone violate, it carries penalties as much as $25,000 to $1.5 million. And as much as 10 years jail time.
But that's in America, so we now need to work on that.
So I think Nigeria now needs to really, you know, which is, I think it's time for the awareness. It's time for Nigeria to know that, okay, yes, to know the benefits, to know the efficiency, to know the importance of software.
And to know that there's also measures for anybody who tries to violate it.
So also know that there's measures, there are laws, there are rules guiding this, protecting it, protecting your information, protecting everyone's data. I can't just go into the system because I know you. Even if you're my sister-in-law, even if you're my sister, I can go into the system and pull up your information. As a nurse, first of all, I'm going to lose my license. Not even am I. Losing license is the smallest deal.
Exactly.
What about the fines? What about the jail time?
Olaide Eniafe, listen, you are by far the most fabulous IT healthcare professional I've ever encountered, but also incredibly knowledgeable. And thank you so much for shedding a lot of light on this. I think we certainly are more interested in EMR or EHR, and we want to look more into it. And I think it's time for us to put Nigeria under some pressure for us to start moving forward.
I think the government really needs to really put the pressure, put the law, like I said, about the HIPAA law that was passed in in 1996 all the way 1996. So like in the US, if you're still on paper chatting right now, government usually gives hospitals subsidy for Medicare, subsidies for this.
Yes.
They take 1% away from it.
Yes.
And then after 2 years, they take another 1%. They take 2%, 5%. It increases.
Yes.
So once you know that, okay, you're losing all those things, and these are money, you're losing all this money. You want to leave paper chatting alone. You want to come back to like, okay, yeah, I think it's time for my chat. It's time to go digital.
Yeah, or it's time to be digital like the rest of the world. And that's all the time we have this morning. Thank you so much. However, you know, it felt short, but trust me, you dropped a lot of gems. We learned a lot from you. So again, that is Olaide Eniafe, who really did school us on IT healthcare. To watch more videos just like this, make sure you subscribe right here. And of course, check out more videos right here.